Yes, it's just me recording myself like I'm recording on my phone.
So everybody's watching me.
No one's watching.
Oh.
Not until I put it on YouTube. Huh? I have to edit it and all the things.
Yes.
Yes.
Mom?
Yes.
I want to tell you something.
I'm sure you do.
What is your favorite ice cream?
Chocolate.
I like to play Fortnite.
That's not an ice cream. Now get your butt out of here. Are you wondering what it's like to work on a med surg floor? In this video, I'm going to share some things with you that you may need to know. So in case you didn't know, I used to be a med surg nurse. I spent a lot of my clinical on the med surg floor. Something to think about if you're getting your ADN is that you will primarily be on a med surg floor in your clinical rotations, and you may get hired on in a med surg floor as well for starters. That doesn't happen for everybody, but chances are very high that you will be hired on in a med surg floor if you have your ADN. Just some food for thought. Now, it didn't take me long to realize that bedside nursing was not for me, but I worked on a med surg floor for a year. How was it, you may ask? Well, it was really interesting. So our ratio at the time, and this was during COVID, was 5 patients to a nurse, and this is in California. And we have a really strong nurses union in California that won't allow us to go above that number. But at times you may find yourself with 6 patients or 7 patients, but I hear in other states they have more, so I'm not complaining. On this med surg floor, for me, it was high stress, high anxiety, because as a new grad, that's typical, that's normal. However, other nurses who have been there for longer years and have been in the career have told me that that is normal. They always have anxiety. As a night nurse, I started my shift by going in early, probably 30 minutes early, and this was not just normal for me, but for every other nurse, whether you're new or you've been there a while. You go to the computer, you open up the charts. First, you look at the board to see what nurses you are, or what patients or what rooms you are assigned to. The charge nurse of the day or night, depending on your shift, whatever shift was before you, that charge nurse is supposed to put on the board your assignments. So how they come to that conclusion of assignments is probably based on your knowledge. So if you're a new grad, you might get those patients with less acuity, with a lower acuity, and those patients that you can manage that have less complex conditions. And so you'll get your rooms, you go into the chart, you look up your rooms and that patient, you see what they're there for, what medications they may need during your shift, and what the last vital signs are. Kind of look at the progress notes. If they came out of surgery, look at those surgery notes, and look at the previous shift's notes regarding that patient. Was there anything that happened before? And of course, you're going to get report after this, but I'm just walking you through step by step of how I organized my day and what it was like. So after you gather the information about your patients, once the previous shift is over, which could be 30 minutes after you get there, then you go and you look at the board to see what nurses were previously assigned to your patients. You go find that nurse and you get report from them. Sometimes it goes smoothly, sometimes you have to wait a little while longer as they're giving report to another nurse. It never matches up. So you're not gonna have one nurse for all of your patients. Sometimes it happens that way and it's glorious because you get it done and you don't have to wait for anyone. You could just start your shift. But most of the time it doesn't happen that way. So you'll have to hodgepodge, wait for this nurse, then go to that nurse and wait for this nurse before you can actually start your shift. But they give you the rundown of what happened on their shift, what they're there for, what typical medications they may need. If there's anything else you may need to know during your shift, they will let you know there. In a perfect world, they will let you know everything. So I would just make sure that I get all of my information from that chart. Now, after after that, after I'm done getting a report, I would go and get all of my medications. We had little carts with drawers that you can put your room number on and stick all your medications in there. And typically you're not supposed to, take out any opioids and put them in the cart, because there's a chance that you can lose that and you will get in trouble for that. So they will see you as stealing the medication if it's an opioid or a higher level type of medication. So I'd get all my medications, I go into my patient's rooms, and I will do my assessment. First patient assessment, give meds if they're due, because normally by 9 o'clock, those meds are due. And some medications are timed, so you cannot give them more than 30 minutes ahead, blah, blah, blah. You have to wait and push it over 2 minutes. So this is a brief overview. I would do my assessment, give any wound care if the orders say to do it at that time, give my first round of meds at that time, and make sure they're all good before I hop on to the next patient's room. So that way I'm done with that patient in a perfect world. But sometimes you get called right back to that room 5 minutes later. Move on to the next patient. By 12 o'clock or so, or 11 o'clock, I'm done making my rounds to 5 patients. You would think that it wouldn't take that long, but it does a lot of times, because there are things you don't account for. There's a lot of variance. You may get a call from the doctor. Pharmacy may need you to come pick up a med if somebody's not available to get it. A patient that you've already been in their room wants you to help them to the bathroom. There's not a CNA available. Things of that nature. So you have to account for a lot of interruptions. But by 12 o'clock, usually, if I don't chart in the room, you can also chart in the room while you're there with that particular patient doing your rounds. So that is ideal. You can put in their vital signs if there's a computer in the room, which there was for me, and be done with that. But by 12 o'clock, sometimes you need to take another round of vital signs for certain patients. By 12 o'clock, you need to take your next round of vital signs and do another check on the patient and things like that. And this is at night, so I usually would not bother them so much. I get my vitals, and if they're sort of sleeping, you will be able to tell that they're rousable, because, they're trying to sleep here, for crying out loud. Sometimes some other medications are due. You need to hang another antibiotic, yada, 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 things of that nature. So that's another opportunity for you to chart. Typically between 1 through 4 o'clock, it's usually quiet. But again, you might have some one-off meds to give. You want to check on your patient. You want to give any wound care that may be needed. Or if you have somebody that has, and some people may have some critical conditions that will require you to check on them every 2 hours, round on them every 2 hours. So you have to take these things into consideration. But that's typically how my day went, and this is a very broad overview. The way that I felt on a med surg floor was very anxious, and like things were just go, 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 go. There were down times about the 12 o'clock hour, but again, you get those interruptions. You may get an interruption from the ER because they need to admit a patient and they need to go to your floor. Whether it's for a surgery the next morning, you need to do the prep, a colonoscopy, you need to do the prep, bowel rest, and the doctor wants to admit them so that they can stay in the hospital for about 2 days, not eating or drinking anything, wound care, whatever it may be. You may get a new admission typically from the emergency room, and they need to give you a report over the phone. You need to go down and get your patient, or they're transporting the patient up now. And that requires a whole nother assessment. So you need to stop what you're doing, go do your initial assessment, give them their orientation to the room, let them know your name, all of the things, right? And how to use the call light to contact you, all of the things. So med surg, you may have a lot of interruptions, and not just med surg, on any floor for admissions or anything else. People may come to the med surg floor post-surgery, so you have to go get them from PACU. They may be patients that have an issue managing their chronic illnesses like COPD, diabetes. They may have infectious diseases like pneumonia, sepsis, cellulitis, They may also have bowel issues like bowel obstructions, GI bleeds, pancreatitis. They may have dehydration and falls. They may be an elderly person that's being admitted from a skilled nursing facility. They may be transferring from the ER or the ICU, downgraded from the ICU because they no longer need critical care or critical medications, and they're more stable. So they will be coming to the Med Surg unit so that you can further stabilize them and manage their care. Med Surg demands that you have a certain skill set. You must be good with critical thinking. You must have strong clinical judgment and critical thinking skills, because you will have a wide array of patients with different types of illnesses. You have to be effective with your time management, learn to prioritize what patients you should see first or care for first, and for every little single call that you may get, it may not be a priority, but they may still continue to call you, and you need to explain to them in a professional manner that the thing that they're requesting is not it's not life or death, basically. You have to be able to communicate effectively with your team, your charge nurse, your CNAs, other nurses. You have to be a team player, because things can get really overwhelming, not just for one nurse, but for everyone on the floor, depending on the night. Offering some help, like offering to change their fluids, because the IV is just beeping crazily and the patient is complaining. Calling them real quick on the Vocera, which is a communication device, it's sort of like a walkie-talkie, and saying, hey, you mind if I change the fluids? Your IV is beeping on your patient in room blah, blah, blah. They might be happy for you to do that because their night's crazy. Or they might call you and say, hey, can you give the meds for this patient? I'm tied up in room blah, blah, blah. So you must be able to be a team player. That doesn't mean you do everything for the person, but if you have a moment of downtime and that nurse sees you in the nurse's station and you're sitting down and they ask for your help, don't turn them down. It's literally a team sport. You have to be attention to detail. That's another strong skill that you must have, because you are still caring for a person that can decline in a moment's notice. And if you see my past videos, there have been incidences where if you don't go check on your patient or round on your patient like you're supposed to, which your hospital policy may say every hour or every 2 hours, whatever it is, if you don't round on them like you're supposed to, you can miss that opportunity for catching when the patient declines, which may lead to death. These are lives in your hands. You also must have compassion and empathy. People may get on your last nerve when they're requesting care. They may ask you for food when they're not even supposed to be eating, or fluids when they're on fluid restrictions, whatever it may be. They may call you 1,000 times and you're already run ragged trying to care for all of these different people, and they won't understand. So having that compassion and empathy sometimes is the last thing that you can depend on. Now for Med Surg, it brings its own challenges. As I mentioned before, there were 5 nurses. there's a ratio of 5 to 1, 5 patients to 1 nurse, typically in California. But in critical situations, you may have a higher ratio to 1 nurse. So you may have 6 to 1, like there was in COVID and some days on my floor. And you have to be able to roll with the punches. You have to be able to offer help where you see other nurses are, in dire straits and in need of assistance. So just dealing with all of those patients at the same time, it can lead to burnout, it can lead to stress, it can lead to you not feeling confident about your nursing care skills. There is also a very steep learning curve when it comes to Med Surg. So you'll feel this panic of trying to remember all of the knowledge that you acquired while you're in nursing school. And nursing school it's like go, go, go. They try to layer and build on top of what you've learned before, but you'll find a lot of times that it feels like it's just, you've shoved all of these things in your brain and you don't know if you can recall it at a moment. If you'll recall all of it, from what you've learned about pediatrics to psychiatric patients to Med Surg patients and all of their different conditions, you may feel like, I'm not gonna be able to recall all of this. So with Med Surg, you get exposed to a lot of different chronic illnesses, But don't despair, because as time goes on, you'll be exposed to those same chronic conditions and you'll start to learn and expect what the doctor will put on the orders. And all of the procedures that they will order will become second nature to you. You'll know what they are. And on a daily basis, you're learning something new, because there will be something you've never experienced before, or a procedure that they're ordering that you've never encountered before, or a medication that you have to give that you've never given before. So, and Med Surg, it is physically demanding. It can be emotionally and physically demanding and charged. So just know that your feet might not get any rest depending on the day. Some days you might have a great walkie-talkies, as we like to call them. They're alert, they're oriented, they're able to get up and use the bathroom when they want to. And they're just there for, observation or something. But a lot of those times, the tasks will be demanding. People can't get up because they have cellulitis in their leg, yada, 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 all those types of things. So I definitely remember getting off my shift and feeling like I earned my paycheck that day and then some. Like, I just had a workout for 12 hours and I felt good. And when I went home and I went to sleep, I went to sleep. There was no trouble. There are staffing shortages at times, so even on your day off, the staffing office will call you to ask if you're able to come in, and I'd be ignoring calls. I don't care. When it's my day off, they will pay you, if you're interested in that, they of course will pay you overtime. And in the era of COVID, it was it like disaster pay or something like that, pandemic pay that they would offer, which is a lot more money. So some people took that opportunity to come in or stay over their 12-hour shift. I couldn't do that. So some people said, yeah, I'll work another 4 hours when the 12-hour shift was over. There were a lot of staffing shortages, and I would not be surprised to find out that even without COVID, that there are staffing shortages. Hospitals there's always this thought that there's a nursing shortage, but they could hire more, they just don't. In a Med Surg floor, you must also recognize rapidly changing patients, their conditions. As I mentioned before, patients on a Med Surg floor can become critically ill all of a sudden. So you have to stay on top of that. Telemetry, you have to make sure that, you see their heart rate if they have a heart condition, that you see the EKG right in front of you. But at our hospital, we had a telemetry unit and they will call us right away. If we were nowhere near the telemetry monitor, they would call us to let us know that your patient in room blah, 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 AFib, we're seeing it on the monitor. So working on a Med Surg floor gives you exposure to all of the foundations that you learned in nursing school, and it closely resembles what you learned in nursing school. You can definitely transfer your skills to ICU, ER, PACU. They're transferable skills and they're foundational and resemble much of what you've learned in nursing school in the first place. There's a diverse patient experience, so you'll encounter all kinds of populations. However, not pediatric on a Med Surg floor, mainly the adult population. So different people from different types of backgrounds. There are a lot of career growth opportunities because you have that foundational experience and you're in the hospital. As I mentioned, it's transferable. Med Surg just gives you a broad range of skill development. You can learn to be a pro at inserting IVs. You can be a pro at anything there, and it's transferable to a higher level care or to ER or, like I mentioned, all the different other units. Med Surg nurses are in high demand because you just basically have a broad knowledge of how to prep patients for surgery, how to care for them when they come back from surgery, what to look for, diabetic patients, declines for chronic illnesses, patients that come from skilled nursing facilities. You just develop a wide range of knowledge. And anybody that tells you that Med Surg is easy is ridiculous, because that tells me they haven't spent a lot of time on the Med Surg floor. They probably came there or were floated there for a few days and thought that what they saw was the end all be all. Like, no, you haven't been there. You have not been there for more than 2 days or for just as a career. It's crazy. It can get crazy. It can get hectic. It is very draining, but also very rewarding. So Med Surg is foundational. You'll learn how to be great with your foundational skills. You'll learn a lot about chronic illnesses that exist out in the community and how to treat them and how to recognize what's going on. Although you are not critical care, you can be transferred over to that because you already know the basics. So then you can transfer over to learning how to do more drips than just a heparin drip. You can manage more drips. You can manage other things. You can also be easily transferable to ED, where they, patch you up and try to send you on your way. But most of all, you know how to give care long range for patients with chronic illnesses and don't know how to manage things. You provide education. You know how to transfer and discharge patients. These are foundational skills for Med Surg. So if you're typically on a Med Surg, my experience in Med Surg, yes, it was exhausting, but it was very valuable to me. It wasn't something that I wanted to continue long term because I realized that I am not a 12-hour person. I'm also not a night person. Well, I'm a night person, but I don't like to work at night, if that makes sense. Like, I've had a 9 to 5 or 8 to 5 for much of my adult life, not all of my adult life, before I became a nurse. So I would have been great in outpatient, but then I discovered I like more research types of roles. I like the position that I have now. It allows me to be there for my children and work on my other interests at the same time as I work from home. So if you have been accepted for a Med Surg position, this is all of the information that you need to know. Don't despair, because Med Surg is a great place to start. Getting some of that experience in Med Surg can also be transferable to other units as well. In my experience at the hospital that I worked at, they were very good at letting you transfer to the next, transfer over to a higher level of care for that unit. If they were in need of nurses, they were very good at letting you go to the ED, or if you needed more skills in IV insertion, going over to the unit for outpatient surgeries and letting you insert those IVs to get some practice in. So hopefully this video has been of some value for you. If you want to know about any other types of specialties, check out this video where I talk more about other nursing specialties you may be interested in. Bye.